Now, I want to tell you, there are some times where people will say, well, my tastes brought me in a little bit of a different direction. I want to tell you a story. We were doing our weight loss study, and the idea was we're going to be vegan, and we're going to be low in fat, and so forth. And a couple of the research participants happened to take a trip to Greece. And they came back and they said, Dr. Barnard, I know this is a vegan study, but have you ever tasted feta cheese? And I said, yes, I have. Tell me about it. And the way they described it was the way an alcoholic described their last drink, was with tremendous fondness. And so I started thinking, why is that? You know, there are a lot of people, when they're trying to get away from fatty foods, cheese is one of the ones that they really have trouble separating themselves from. Is anybody in this audience, you know what okay, you know what I'm talking about? I started wondering, why is that? And we don't fully know, but there's one thing that we think may be an issue. The casein, have you ever seen casein on an ingredients label? C-A-S-E-I-N. That's dairy protein. It's the protein, the main protein in milk. And there's a little bit of it in cow's milk. There's a lot of it in cheese. And in your digestive tract, it breaks apart to produce chemicals called casomorphins, casein-derived morphine-like compounds. And you think, what's that about? These are compounds that in the brain, we believe, they actually attach to opiate receptors and create just a little bit of feel-good. Now, the research in this area is still going on. But the hypothesis is that in the same way as the nursing calf gets protein and sugar and fat and hormones and growth factors in the milk, there's a little bit of feel-good so that the nursing calf says, I want to stay close to mom, instead of wandering into the woods. And if you ever looked at a nursing baby, there are casomorphins in the baby's stomach too after nursing. And nursing babies get this goofiest expression on their face, and after they nurse, they fall into this deep sleep, and we assume that's the beauty of the mother-infant bond. Well, I hate to break it to you, you just drugged the kid. Okay? So what this means is, even though we're adults, we may be having addictive responses, if I can use that word, to certain foods. Anyway, stay tuned. There's a lot more research that needs to be done on that, but it may well be that there are some changes there too. Okay, let's do a little test. I want you to tell me if certain foods are high glycemic index or low glycemic index. Are you with me? Okay. Black beans, are they low or high? Low. Okay, good. Broccoli, low or high? Low. All right. White potato? High. Yam? Low. Sweet potato? No. Bran cereal? No. I think you got it. Very good. Okay. How about grapes? Low. Okay. Good. All right, good. Well, that's the glycemic index. If you think about staying healthy, the most important consideration is your heart and your blood vessels, because if your circulation isn't good, it affects your vision, it affects your kidneys, it affects your extremities, it affects the whole body. But the good news is that foods and lifestyle can make all the difference in whether we get artery blockages or whether our arteries stay clear and clean like when we were teenagers. And for me, the page really turned in 1990. A researcher named Dr. Dean Ornish showed that not only can we prevent artery blockages, even after they're there, there's a lot we can actually do to reverse them. Now, Dr. Ornish's program used 4 steps. First of all, he said a vegetarian diet. Now, why would he want a vegetarian diet with people with clogged arteries, heart patients? Well, because you want to get away from the cholesterol, right? You want to get away from the animal fat. Secondly, he said no smoking. Of course, that's important. He said try to reduce stress, which is why he didn't do the study in Washington, D.C., where I live. And the last thing was exercise. But this wasn't really intensive exercise. It was about a 30-minute brisk walk every day or an hour 3 times a week. There were no drugs, not even cholesterol-lowering drugs. But after a year's time, the results were dramatic. Cholesterol dropped about 24%, and LDL, bad cholesterol, dropped 37%. And your average person lost 22 pounds in the course of the first year. Now, some of these people were pretty slim to start with. Others were quite overweight, but the average person lost about 22 pounds. And then the most important thing, the thing that really made medical history, was when you look inside the arteries, you're looking at the artery blockages that are there. And the artery blockages, they start out soft, but they gradually harden. And as the years go by, they become almost like concrete. And when you look in the arteries with an angiogram, what he could show was that they were actually starting to open up again. Researchers had thought this was not possible, but they were actually opening up again so much that you could see a measurable reopening in 82% of the patients in the first year. No drugs, no surgery, just these very simple lifestyle changes. So changing your diet and lifestyle really turns everything around. So, all right, what should my goals be? If I am looking at my cholesterol test, what do I want it to be? Okay, you look at your total cholesterol first, and the federal government says keep it below about 200. Does that sound familiar? And that's a good goal. You definitely want to be under 200. However, some research has said you want to be a lot under 200 because if you go down to 190, 180, 170, your risk tends to drop down to about 150. And at that point, there isn't a lot of benefit to going lower. Now, do you know about LDL, bad cholesterol, LDL, low density lipoprotein? That L means keep it low. And our government would say keep it under about 100. But a lot of researchers are saying, no, let's even keep it lower than that. Let's go to 80. Let's go to 70. That's bad cholesterol. We definitely want it low. And have you heard of HDL, high density lipoprotein? That H means keep it high. And people describe HDL as sort of a dump truck, that it's picking up that cholesterol and it's carrying it out of the body. Now, for men, you want it to be above about 45. For women, I'm going to ask more. I want it above about 55. Now, I have a caveat. Let's say you've been following my really healthy diet and you're exercising and taking good care of yourself, and all of your cholesterol numbers are low. In that case, talk with your doctor. You may not need to hit those really high HDL numbers. You just don't have so much cholesterol in your body, and you don't need so many dump trucks to carry it all away. Now, there's one more number you're going to see on your cholesterol test, and that's triglycerides. It's a big word. All it means is blood fats, little bits of fat that gets into your bloodstream, and your goal here is 150. Keep it below 150. All right, so what do? Those are my numbers. How do I get my cholesterol down? Well, I have a little lesson. When I was a kid growing up in Fargo, my mom had 5 kids, and we'd get out of bed in the morning, we'd run down to the kitchen, and my mother was cooking up bacon. And she would take the strips of bacon out of the frying pan and she'd put them onto paper towel to cool. And then she would take that hot skillet and she would gradually tilt it to save the bacon grease. She would put it into a jar. And you know what? That jar of bacon grease did not have to go into the refrigerator. She just put it on the shelf because she knew that as bacon grease cools down, what happens to it? It solidifies. You don't have to refrigerate it. And the next day, she'd take it out off the shelf, spoon it back into the fry pan, and fry eggs in it. It's amazing any of her children lived to adulthood. But, I mean, that's the way we ate in Fargo in the 1950s. What can I say? All right, so where is the fat lurking in the foods that we eat? Well, the leanest beef, or the leaner cuts of beef, around 29% fat. Now, the leanest chicken, if I take the skin off, throw away the dark meat, it's about 23, so it's not dramatically lower, which surprises a lot of people. Americans now eat, believe it or not, more than 1 million chickens per hour, imagining this to be really health food, and frankly, we're not in such great shape as a result. So chicken is a lot more like beef than it is like broccoli. Now, fish vary. Some of them are lower in fat, some of them are higher, some are a lot higher, like Chinook salmon, for example. But it's not just how much fat do they have. It also matters what kind of fat is in these foods. So beef fat is about half bad fat. That's that saturated fat. That's the solidified bacon grease. And the way you can tell it is that at room temperature, it's a waxy solid. That's a sign that it's a lot of bad fat, saturated fat. Now, for chicken, it's about 1/3 saturated fat. For fish, a little bit lower, between 15 and 30% saturated fat. And I want to make sure you understand that, because people say fish has good fat, right? That's true. It's got omega-3 fats, which can be healthful. But that's only about maybe up to about 1/3 of it. And another maybe 15 to 30% is plain old bad fat, and the rest is a bunch of fat that you really don't need. So all these fats are mixtures. Now, olive oil, better choice too, but even with olive oil, it's about 13% saturated fat. So that's why my message is you want to avoid the animal products, but keep all oils rather low. And one other thing, this is for extra credit. Cholesterol is not the same as fat. Fat is that yellow part under a chicken's skin, or the white streaks in a steak. That's fat. But cholesterol is invisible. Cholesterol are tiny little particles in the cell membrane that surrounds the muscle cells. So in a steak, the cholesterol is mainly in the lean portion. So you can strip away the fat. That's a good idea. But in the lean portion, there is cholesterol in all of the cell membranes. and that will add somewhat to your cholesterol level as well. It's not as bad as fat, but it's a problem too. So it's in all animal products, but there's essentially no cholesterol at all in anything from a plant, which is nice. Now, there is something that you'll sometimes see in snack pastries. You'll see it in fried foods, and it's called trans fats. Any of you seen this? You often won't see the word trans fat. What you'll see is in the ingredients label, it'll say partially hydrogenated vegetable oil. What they mean is this. If you take a plain old vegetable oil and you cook potato chips in it, you put it in a bag and you send it out, it tends to go rancid before too long. It gets stale. And so the shelf life is not very good. But the manufacturers learned a long time ago that if you hydrogenate that oil, what they actually do is they harden it. They add hydrogen atoms to it and it becomes hard. Well, they found that the shelf life of that bag of potato chips is about 3,000 years or something. Well, not quite. But I have to say it won't do anything for your shelf life at all. So you want to avoid those completely. So keep all fats low. Now, there are some foods that have sort of a special effect. And you've heard about oatmeal or oat cereals as lowering cholesterol. They really do. What they do is they trap cholesterol in your digestive tract and they carry it away. That's good. They're not the only things that do this. Beans will do this. Barley will do it. Many fruits and vegetables have a cholesterol lowering effect. Soy products also. So researchers said, well, what happens if we put all of this together? What if we start with a vegan diet and then we add soy products, we add other foods like oats, and we see what can the effect be? They brought in a group of people and they found that the effect can be almost as strong as cholesterol-lowering drugs, and it happens very fast, just within a matter of a couple of weeks. Now, what if I need to boost my HDL, my good cholesterol? You remember what we were talking about, H high? You want it high because it's the dump trucks carrying cholesterol out. Well, exercise will do that. Exercise is good in every way, and one of the benefits, it can boost your HDL by several points. Vitamin C rich foods, and you know what I'm talking about, things like oranges, citrus fruits, many others, they also will boost your HDL, which is good. What if I need to lower my triglycerides? You have a lot of control over that in many cases. Going low fat is good. Going low glycemic index, that means keeping the sugars and the white bread low. Exercise is great there too. All right, let's shift gears. What if my problem is my blood pressure? My blood pressure is high and I need medications to bring it down. We really need to keep that under control because high blood pressure is tough on your heart. It's tough on your arteries. So when your doctor or healthcare provider tests your blood pressure, they give you two numbers, right? They might say 120 over 80, 130 over 80. What do those numbers mean? Well, that first number, the 120, that's the pulse as your heart is beating and it sends a wave into your arteries. That's the systolic number, the first number in your reading. The second number is diastolic. That's the relaxation between. So you go up to 120 with each beat, down to 80 between, up to 120 and down. See? So we want both of them to be fairly low. What should our goal be? A good healthy blood pressure, most people would say, is just about anything below about 130 over 80. So what foods should I be eating to keep my blood pressure down? Well, for a lot of people, if their blood pressure is a little bit high, the first step they're going to make is to cut down on sodium. Good idea. Avoiding salts is a good idea. But for a lot of folks, they don't quite get as much benefit from that as they're really looking for. They're not able to get away from their medication. So let's add a little bit more. Vegetables and fruits are typically very low in sodium and they're high in something called potassium. And that seems to help us keep our blood pressure down. Vegan diets will do it. Exercise will do it as well. And if you put all this together, you get a very nice blood pressure lowering effect. Now, the good thing is that you don't need one diet for your diabetes, another diet for your weight. If you're on a plant-based diet that's low in fat, keep the sodium low, it works together all very, very well. It controls your blood pressure and everything together. Okay, let's put all this together and see how to take good care of ourselves from the top of our head to the bottom of our feet. Let's start with our eyes. If your blood sugar is high, your vision can get blurry. And there are two important points. The first is you definitely want to have your glucose under good control. But the second is don't get new glasses when your blood sugar is too high, because as your blood sugar comes back down, you'll have a new prescription. But you don't want to keep a high blood sugar. This can be harmful to the tiny little vessels in the retina, the back of your eye. So you want to have good control of your blood sugar, but also get a dilated eye exam as soon as you're diagnosed and about every year after that time.